Hi everyone, good day. I am Carla A. Pitogo, and my report for today is the continuation of the report of Miss Bibi Joy Pineda, and my report is all about stem cell therapy. So what is stem cell therapy? Stem cell therapy, also known as regenerative medicine, promotes the repair response of disease, dysfunction, or injured tissue using stem cells or their derivatives. It is the next chapter in organ transplantation and uses cells instead of donor organs, which are limited in supply. It is a non-invasive treatment that aims to replace damaged cells within the body. It is a form of regenerative medicine designed to repair damaged cells within the body by reducing inflammation and modulating the immune system. This phenomenon makes stem cell therapy a viable treatment option for a variety of medical conditions. So ang stem cell therapy po, ito po yung treatment na hindi niya sinisira ang mga cells na nasa ating katawan. So ang kanyang goal po is to replace kanang iyahang pulihan o iyahang i-repair, iyahang kukumpunihin ang mga cells na na-damage na sa ating katawan. Where those stem cells come from? Stem cells can be obtained from many different sources. These include adipose or fat tissues, umbilical cord tissue, placenta tissue, umbilical cord blood, or bone marrow. So, ang stem cells po ay makukuha po natin sa ating mga fat or sa ating mga taba-taba sa katawan. Tsaka po sa umbilical cord tissue sa ating pusod at tsaka sa placenta tissue at sa mga inuna ng babies at tsaka po sa umbilical cord blood sa yung dugo ng ating pusod at tsaka po sa utak ng ating mga buto-buto. So when we said utak sa ating buto-buto, yun po yung mga laman ng ating buto. How are stem cells administered? Stem cells can be administered in a variety of fashions. Stem cell therapy or intravenous administration, intrathecal or directly into the spinal canal, site injections into problem areas such as knee, hips, hands, and many more. So, ang stem cell therapy po is may dalawa po siyang administration kung paano po siya isinasagawa sa ating katawan. So, the first one is the stem cell therapy or intravenous administration. So, intravenous administration, ito po yung administration that involves a single injection followed by the insertion of a thin tube or catheter into a vein. So yun po ang intravenous administration. So, when we said po na intrathecal administration, ito po yung directly into the spinal canal. So, ini-inject po nila yung injection sa ating spinal canal po, yung wala na pong paligoy-ligoy, directly na po yung pag-inject. So, sinasite din po nila yung mga lugar ng ating katawan kung saan may mga problema po, such as yung tuhod natin, yung ating bewang, or yung ating mga kamay po, at saka marami pa pong iba. Two main types of stem cell transplant. So, we have here two images po, two pictures. So, the first one is the autologous transplantation. So, in an autologous transplant, your own blood-forming stem cells are collected. You are then treated with high doses of chemotherapy. The high-dose treatment kills the cancer cells, but it also gets rid of the blood-producing cells that are left in your bone marrow. Afterward, the collected stem cells are put back into your bloodstream, allowing the bone marrow to produce new blood cells. So, sa first po natin na picture is yun po yung, if ikaw po yung pasyente, is ini-inject ka po or kinukuha po yung mga stem cells life-forming stem cells po na nanggaling po sa inyong katawan. So, kinukuha po ito. So, after kinukuha po niyan is inaalaw ka po nila to undergo into chemotherapy po. So, itong chemotherapy is a high-dose treatment po na pong pinapatay yung mga cancer cells po na naa sa ating katawan. So, after po undergoing chemotherapy is ito na po yung panahon na yung mga collected po na stem cells na kinuha po sa ating katawan is pinuput back po nila yung ini-inject po nila again sa ating katawan para po yung sa ating bone marrow po, inaalaw po na mag-produce og new blood cells po para sa ating katawan. So, the second picture po is, ito po yung tinatawag na allogenic transplantation. So, in an allogenic transplant, a person's stem cells are replaced with new healthy stem cells. The new cells come from a donor or from donated umbilical cord blood. So, chemotherapy or combination of chemotherapy and radiation therapy is given before the transplant. So, ang ating pangalawang picture po is, mayroon na po tayo doon na donor at saka pasyente. So, yung donor po, siya po yung inaalaw niya yung kanyang sarili para mag-donate ng new healthy stem cells. So before po sa transplantation po na yun is, ina-undergo po ang ating pasyente to go into chemotherapy or combination of chemotherapy and radiation therapy. So, after po nila undergo sa chemotherapy, doon pa po yung time na mag-transplant na po sila into new and healthy stem cells. Next po is we have types of allogenic transplantation. So, in allogenic transplantation, there are unmodified stem cell transplant, T-cell depleted transplant, cord blood transplants, and donor lymphocyte infusion or DLI. Fun facts about stem cell therapy. So, researchers grow stem cells in a lab. These stem cells are manipulated to specialize into specific types of cells, such as heart muscle cells, blood cells, or nerve cells. The specialized cells can be implanted into a person. In a country where many elites are obsessed with the natural aging process, wealthy Filipino are selling out between $12,500 and $18,000 per session of stem cell therapy in the belief the treatment will improve their overall health and make them look younger. So, fun fact po about stem cell therapy po is, yung mga researchers po natin is nag-grow po sila ng stem cell sa kanilang laboratory po. So, bali, meron po silang isinasagawa na research to develop stem cells po. So, yun pong mga stem cells na kanilang dine-develop or inaalagaan po, it is a specialized stem cell. So, it will specialize into specific types po. It has heart muscle cells, blood cells, and nerve cells. So, yun pong stem cell, yun pong specialized cells po, is pwede po yun ina-transplant po, pwede po yun ita-transplant sa isang tao po. So in our country po, we all know na there are different kinds of people na obsessed po sa kanilang nature, sa kanilang physical appearance. So there are Filipinos, yung mga yayaman na Filipinos na bumibili po sila ng stem cell, na yung stem cell po is, ang effect po iyon sa body ng isang tao is, you will look younger. So yun po is, binibili po nila yon sa halagang $12,500 up to $18,000 per session po. So, binibili po nila iyon para po sa rason na gusto po nila nga sa kanilang mga mata is they are look younger po. So, yun po, binibili po nila yung mga kagaya na ganun na stem cell, yung stem cell na may aging process po. According to Filipino-American Dr. Lawyer Samuel Bernal, an expert in the fields of regenerative medicine and regulatory law, the public should take a lot of precautions. It's not a cure at all. It is actually trying to allow the body to heal itself. It requires analyzing at the molecular level what is causing the problem or what could be done to prevent the problem. It's just a small part of the molecular approach to medicine. So, according to Samuel Bernal po, stem cell po is hindi po siya yung medicine na kinukure po niya lahat, yung i-heal po niya lahat. It is actually po na inaalaw lang po niya ang ating mga katawan na mag-heal po sa paraan na ma-heal po siya. Dr. Lawyer Samuel Bernal, educated at Johns Hopkins and Harvard Medical School, he is currently Professor Emeritus of Medicine at the University of California, Los Angeles, a member of American Association of Clinical Oncologists, the American Association of Cancer Researchers, and recognized as cancer investigator with the U.S. National Institutes of Health. So I have here a picture of what a typical stem cell procedure look like. So first, we should be harvest. So when we said harvest, it will be extract a small amount of bone marrow from iliac or fat from waist area. So after we harvest, we separate. So it will be separate stem cells from other cells. So after we separate, we activate. So activate is when activate stem cells with laser or specific wavelength. So after we activate, we treat it to our patient. So it will be infuse activated stem cells into body through lumbar puncture. So it will be going like that: harvest, separate, activate, and treat. So that will be the typical stem cell procedure look like. So that will be all. Thank you for watching. Bye.